Peds Patrol here, and very tragic news from Montreal where a 4-week-old baby passed away from a tongue tie release. So let's talk about tongue ties and if they really work or not. So as you can see here, this is what's a tongue tie, which is a little bit of tissue underneath the tongue that's attached to the lip. In many cases, it does not cause any feeding issues. However, moms can feel that it can cause significant pain, as well as issues with latching and poor feeding. You may see some recommendations from lactation consultants or other allied health professionals to consider getting the tongue released, and this may help with some feeding issues that the child may have. You'll find that a lot of pediatricians don't recommend tongue tie release, and that's because the evidence isn't really that strong, and that's both from the Canadian and the American pediatric societies. With time, with practicing feeding, potentially help reduce this problem and can help support feeding over the long term. A tongue tie release is a surgical procedure, which means it doesn't come without any risks. Now, this story is a little bit unclear on what the events happened. However, there are some things that you need to consider if you're going to be going with this procedure. With any surgical procedure, you need to make sure that you know your family history quite well. Surgical complications can include some bleeding issues and bleeding risks, so making sure that there is no bleeding history in the family. That can include anybody with very long nosebleeds or prolonged periods or having significant bruising or swelling when there's not supposed to be. The other thing to ask for is whether or not there was anybody with any anesthetic complications or allergies. So was there anyone in the family sensitive to a medication that helps them go to sleep? And did that cause any issues like difficulty breathing, stopping breathing, a rash, or changes in their blood pressure? Last but not least, make sure that if you are going to get a surgery, whether it's for a baby or for a toddler, that you get it from a qualified individual with multiple years of experience, because this can help make sure that your child is in the best care. As always, read the consent quite carefully. Make sure you ask any questions that you do have. And sometimes just time and practice is all you really need to help feeding get better and better day by day.